So it's with a great pleasure that I warmly welcome you on behalf of the Competence Centre Future of Work of the Friedrich-Ebert-Stiftung and also on behalf of EPSU, the European Public Service Union, to the launch of our joint study on care platforms, impacts and challenges from a trade union perspective. As it was already said, my name is Oliver Philipp, and I'm a policy officer at the FES Competence Centre Future of Work based in Brussels. This morning, I had a quick look at the participant list, and we have participants from all over Europe, but also from other parts of the world, working for trade unions, but also civil society organizations and European institutions. And I think it shows pretty well that the topic of care platforms in long-term care sector is of significant interest and importance. I believe we can all agree that the provision of quality long-term care for an increasingly aging population has emerged as one of the greatest challenges facing European societies. And however, this sector is characterized by low pay, by precarious working arrangements, and a high percentage of dependency on migrant workers. Now, for decades, government policy has sought to outsource care provision to private providers in both the residential and home care sectors. Therefore, we observe that the increasing demand and growth in this segment have attracted increased interest from platforms, making care provision an expanding segment of the gig economy. And to be honest, when we think of online platforms, we immediately think of transport and delivery platforms, such as Uber or Deliveroo, for example, but not of care platforms as care.com, for example. But maybe surprisingly, the number of caregivers on the platform care.com alone exceeds the number of Uber drivers worldwide many times over. And I think this makes exploring the long-term care platform economy a pressing issue. And we need more research on this in order to understand the challenges that are emerging in relation to the increased appearance and use of platforms in the care sector. So this is why FES and EPSU have initiated last year a joint research project on the platformization of the long-term care sector. And we're very happy to finally launch this study today, as well as a shorter overview report, which will be also available in German. So this research outlines different approaches unions can take to address employment conditions in the care sector, including specific action in relation to platform work to ensure that workers have a voice. And this study will be is published on the FES website and also on the EPSU website, or soon on the EPSU website. And after the event, we will, of course, send you a link to the study. So to end, I'm very happy that the two researchers are with us today. The third researcher, Tish Gibbons, can't be with us, but still I want also to thank her, and of course also to thank Dana-Carmen Bachmann and Ursula Huws that they accepted our invitation and that they are here with us. And last but not least, of course, also to thank EPSU for this cooperation. So I wish all of us a fruitful discussion, and we hope you find it interesting and useful. And again, please apologize the hiccup at the beginning. And
Great, thank you, Maria. So as Pete said, I'm Dr. Caroline Murphy at the University of Limerick, and in conjunction with Ivana Pais and Tish Gibbons, we began researching on this topic last year. One of the first things we noted was the extreme mention of affordability in care services in much of the research that we looked at. And indeed, a 2022 report from Oxfam highlighted the fact that there was a belief that the spread of platforms in domestic and care sector is very much linked to the fact that there is a crisis in relation to the affordability of care services. So care and domestic work are often used interchangeably as terms, and indeed a significant overlap does exist between them. But in our study, we're focusing specifically on home care as a subset of the long-term care sector. So care of older persons, care of persons with a disability in the private home setting, and work that primarily relates to supporting the instrumental activities of daily living, such as assistance with basic personal and medical care, which may include some forms of domestic related tasks. Why the focus on home care specifically? Well, as Oliver alluded to, the provision of care is something that affects everybody, either as caregivers or care receivers. And supporting aging in place is a policy of the European Commission, of the European Parliament, and all over the European Union. States are moving towards supporting aging in place over institutional and residential care. But providing that care is both an economic and a demographic challenge for Europe. Indeed, the European Care Strategy has highlighted that currently 1/3 of households with long-term care needs do not, in fact, receive domestic care services due to affordability. So in undertaking our research, we wanted to look at a review of the long-term care sector in Europe and the emergence of digital platforms, but specifically looking at the challenges and impacts for trade unions in that regard. So we interviewed and spoke with unions, some platforms, worker representative bodies, and family care representatives to understand the kind of developments that are occurring and identify possible opportunities for trade unions in representing workers and having a wider impact on labour developments in this sector. So the next slide, please. So in terms of relevance to trade unions, we'll talk about that a little bit later on in terms of why we feel there is a gap in the literature, specifically in relation to platforms for the relevance to trade unions. So the next slide, please, Maria. Over 28 million people worked on platforms in the EU in 2022, and this is expected to rise by an even more significant amount by 2025. The business model of platforms shares similarity across countries, typically with a high volume of workers being able to access platforms due to low criteria for entry. They typically consist of a largely highly individualized workforce that lack a common identity, and a frequent turnover of workers is a feature. For workers, of course, the draw of platforms is providing access to a large marketplace. The type of platform work that home care specifically occupies is very much time and place dependent, locally delivered services. The digitalization of the work lies in connecting workers with clients in need of care via an app or website. Next slide, please. The initial focus on platforms, I think it's fair to say, has had a type of Uber bias to it, with much of the literature being characterized by information which focuses on the workforce characteristics and the actions that unions have taken in ride-hailing, delivery, logistics sectors. But for unions in particular, the type of lessons that can be drawn from those sectors and applied in care are relatively limited because care presents a very different context. In transport, platforms typically circumvent existing regulation. They offer flexibility and cost efficiencies to the consumer. In contrast, platforms in care tend to occupy grey zones where there's already a very high level of informality existing. Transport is indeed a very male-dominated sector, with some parts already having very high unionisation, and where the ability to withdraw labour creates a very visible public effect. In comparison, home care is highly feminised. 9 out of 10 workers are female, 1 in 4 are migrant. Employees in care tend to earn comparatively less than employees in other sectors, even where they hold the same levels of qualification and experience. It's often characterized by informal working arrangements and a limited form of worker organization, particularly in domestic and home care area. Working conditions, of course, are very much invisible to the public. The work that's carried out is in the private home themselves. Therefore, connecting workers with unions has even greater complexity than it does in other sectors of the economy. An absence of regulation already in home care sector has been associated with fueling informal arrangements, and the grey market of care is a significant factor that leads to difficulties for employment inspection in the home care sector as well. And the risk of exploitation increases even further when we move to thinking about live-in care arrangements and workers involved in those types of care. Next slide, please, Maria. Thank you. So the platform economy in domestic care has already been found to be significantly growing in terms of its economic impact. And we already find that there is a presence of platforms in the sector. What's interesting is that the existing literature points to the fact that many care platforms tend not to be associated with the terminology of the gig economy or platforms. Indeed, a distancing of organisations in care between the association with gig work, which isn't seen as something which is maybe comparable or compatible with the care provision. Platforms might be used as sole providers of care, but more often than not, they're used by families in addition to other forms of care provision, like familial care or existing publicly funded or even publicly provided care. Where people that sign up to platforms are matched with carers and caregivers based on their geographic proximity. So digital platforms themselves tend to operate on a number of formats, some in a similar way to traditional private placement agencies, offering recruitment, follow-up, charging clients an initial fee for matching carers and conducting registration requirements and so on, but others in more of a traditional platform approach that we tend to recognize more associated with the platform economy. So the next slide, please. So in terms of the features that we associate with the platforms, we already see existence that there's both international and Indigenous organisations emerging. We're of course aware of some very large international chains that exist. But when we look at a country by country basis, we see that there's also Indigenous national organisations emerging in the platform space, some small, some larger. What we're also seeing in some national contexts is a transition between existing agency models moving towards a more platform-based model. And they may have multiple reasons for this. There may be cost reasons, there may be regulatory reasons, there may be reasons why even workers themselves or families are looking at this as a particular option. So there's multiple drivers involved in this change from traditional agencies to being more of a platform-based model. When we looked at our research as well, we also saw the emergence of both commercial and cooperative forms of platforms. And that's something Ivana will speak about in the Italian case. For the predominant model that we see in terms of commercial, we see international provision, and we see smaller types of organizations emerging as worker cooperatives in the platform space. I think what's important when we look at the platforms is, from a care perspective, the range of services that are actually provided by platforms. We see much more overlap between care and domestic services in a platform-based model than we did in more traditional home care type of agencies. So whilst in the past there might have been greater differentiation between the roles involved, we're now seeing a lot of overlap and blurring of lines in the services provided between home care and domestic services. Another feature of the platforms is the type of detailed profiles that are available and are provided about the workers. So some of these are visible without subscription, some have limited visibility without subscription, and then are fully available to clients once they sign up with a subscription fee. Generally, platforms do require carers to be able to demonstrate a level of experience, references, and ideally have some form of recognised care qualification. And in some cases, this will be verified or certified through the platform. Also, ratings are made available from the clients themselves. So carers will find that there will be ratings attached based on the number of clients they've had, the level of care that they're associated with providing, and so on. But this isn't the case in all platforms. Platforms are seen as providing a level of administrative support in the arrangement between the client and carer, such as insurance, template of a contract in the case of long-term placements, and some may even endeavour to provide replacement carers, but most do not actually guarantee to do this. The fees and rates that are charged in terms of commission vary across the platforms, and from what we can tell, typical rates tend to be between 10 and 16% of transactions. In terms of the negotiation of rates on a case-by-case basis in platforms, it's very much up to the workers to negotiate rates for short-term, on-demand types of services. There's some evidence of workers advertising rates which might be considered below the standard wages that would be set in the sector already. However, in most contexts, for workers, one of the attractions of the platform is the ability to negotiate rates perhaps that are more attractive to what they might be able to attain in a traditional placement agency. For others, it is, of course, the flexibility that appeals through the platform model in order to go through that particular route instead. Their ability as well to engage in negotiation of things like travel time or mileage rates, of course, as well, is part of their ability to negotiate. But all of these outcomes are entirely dependent on workers' individual capacity to negotiate those rates with the family or with the person that they're caring for. So the next slide, please. Despite many platforms claiming that they offer a very innovative approach to care provision, the literature is already beginning to suggest that there's very much parallels emerging between the problems that exist in traditional home care delivery and the problems that exist in the general care economy. So are we seeing a situation emerge where platforms in care are providing something drastically different to what we've already seen? So far, we would say that there's very much a growing convergence between the problems that are existing in care delivery generally and the problems that are existing in platforms. For unions that we spoke to, one of the biggest problems for unions is the invisibility of this care workforce. So when we interviewed unions, they made claims like, as a union, we generally act where there is demand. And so far, we're not seeing the same kind of demand in this particular workforce with unions. So people in this workforce aren't contacting unions, they're not reaching out, and those workers aren't visible on the street to the same extent that workers in other parts of the gig economy would be. What is interesting, though, is that these workers are highly visible online. So when we move to the digital sphere, when we move to the platforms themselves, and when we move to social media forums and social media channels, we actually see a high level of visibility for these workers. So I think there's a major importance here for unions on focusing on the digital communications and being present in this digital sphere to reach these workers. So we need to have a form of connected and collective strategy to reach workers. In the physical realm, their work is going to remain largely invisible in the private sphere, and they do remain difficult to reach. Therefore, for trade unions, we need to think more broadly about the kind of strategies that can apply to this workforce. And we'll do that later on in this presentation, looking at the kind of things unions can do in this space. So if we move on to the next slide, please. From a union perspective, keeping pace with privatisation has already proved really challenging in the home care sector, and platforms just present the latest in the range of challenges for unions. For many platforms at a national level, platforms aren't even on their radar yet, but they're already rapidly growing. Workers who are already unionised may not be aware of additional carers entering homes and providing care for clients that they're already working with. So they're not necessarily having interactions with other workers who provide care, but work in quite a different model. So the potential for grassroots organising is quite limited in this space. And this is something unions need to consider, is how can they look at that kind of grassroots mobilisation that they may already have in their existing home care unionised members. Unions have very significant concerns regarding the vulnerability of workers. there's a very significant relational element to the work that limits workers' capacity from exiting negative working arrangements. And live-in carers in particular would be particularly vulnerable to this. Unlike transport, unlike logistics, and unlike platforms in those sectors, where there tends not to be a definite repeat relationship between client and platform worker, that is not necessarily the case here. The case here is very much, actually, in many platforms, encouraged that there is a repeat relationship between the carer or even a domestic worker and existing client. Therefore, withdrawal of labour, moving on from that working relationship, can be quite difficult where a deep relational bond develops. And in care, that is something which can happen naturally or which can happen through a sense of obligation on the carer's part, because there is a significant vocational element to care. Worker power to negotiate rates and terms is now very individualized. The focus on immediate pay and flexibility is present at the absence of a focus on longer term issues such as the existence of pay scales, paid time off, travel expenses, pension, and other social security entitlements. Therefore, accessing supports as well, even that support care provision like specialist training or access to specialist equipment that carers may need in care provision, may be sacrificed in this care relationship, because it's the person caring in the home who may have the greatest voice in that, but don't necessarily know or have the channels with which to engage in seeking those forms of support. And finally, for trade unions, home and residential care facilities are often organised in tandem. So whilst you might have workers working in a home care setting, you might also have workers with the same job title working in a residential or institutionalized care setting. Therefore, there's knock-on consequences and a broader impact concerning possible erosion of existing terms and conditions of organised workers. So the next slide, please. In terms of relevant EU policy and actions, the European Care Strategy already refers to a person-centred approach to care involving a greater choice for both public and private investment is needed. So it's focused very much on, from an employment perspective, promoting greater collective bargaining and social dialogue to improve wages and conditions, focused on ensuring greater health and safety standards, and designing continuous education and training for workers, including professional qualification using objective criteria, upgrading formal workers' skills in line with a harmonised career structure, tackling gender stereotypes in care, and finally ratifying the ILO Convention on Domestic Work, of which has been a relatively low take-up at national level. So for trade unions, being aware and understanding the importance of how the European Care Strategy is interpreted and implemented at national level is of significant importance, and making sure as well that there's recognition of how platforms might be shaping, or platforms might indeed be shaped by, that European Care Strategy at the national level is very important. The second action and policy that's of significant importance in this sphere is, of course, the directive on platform work, aimed at improving working conditions whilst also preserving the opportunities and benefits brought about by platforms. For care workers, an understanding of their employment status and the consequences in terms of social protection and longer term benefits of that employment status is important, and unions have a role in communicating that. A legal presumption of employment at national level could pose difficulty for many of those providing care based on some of the national level tests. And of course, that is where the directive on platform work and its interpretation and application of that at national level again become important. And finally, the directive on adequate minimum wages and collective bargaining coverage is important. Domestic and home care provision is a sector which is immune to offshoring, largely immune to technological change, but is a growing sector amid the increasing size of the silver economy. Therefore, if collective bargaining isn't present in that sector, it's a very significant proportion of the workforce that over time will not be covered by adequate collective bargaining. And it's something, again, that in the interpretation and application of that directive at national level, it is important how that directive will play out. The next slide, please. In terms of union approaches, we would look at this and say that there are really three ways in which unions can act or can approach the emergence of platforms in their national economies. So in order to look at this, we identified three different ways in which unions can approach it. The first approach unions can take is to say that there's a complete rejection of platform work, where therefore they focus their efforts entirely on lobbying for broader regulation of employment at national level. So examples here would be things like example cases from Spain, where, for example, claims were brought around an intermediary status and whether or not organizations might be able to exclude certain organizations from a presumption of employment. And there have been particular cases there where one domestic platform, for example, was deemed to provide orders and instructions via the platform, and therefore it placed limits on the services that workers could actually provide. So that would be important in terms of looking at that as something which organizations and unions might say, well, that's important from a national perspective at looking at whether or not we can look to regulate platforms more strongly. A second approach then is to look at care as a sector more specifically. And instead of focusing on platforms, look at the regulation around the care sector itself. So here a focus is more on looking at how care is provided, for example, through how care is funded at the national level. So there have been some examples, for example, in Germany, there was a case highlighted by the European Federation of Food, Agriculture and Tourism trade unions, and that looked at how a voucher-based system contributed to tackling undeclared work and informal work in the domestic economy and in domestic work. And it did help to foster a greater set of domestic services through subsidised tariffs. However, even though while they pointed out the benefits of that in tackling undeclared work and informal work, they themselves would also say that it failed to tackle things like recognition of worker qualifications, and it failed to challenge gendered and migrant nature of domestic work in that sector. In Germany, you can look at examples around, for example, reform of the long-term care insurance that has been established there. So, for example, increases in how long-term care is to be funded. And also, again, looking at things like the Care Staff Strengthening Act. So how collective bargaining agreements and pay standards are applied to the domestic care provision providers. The third approach to platform work is to look at this as a growing feature of care and adopt active organising strategies that specifically focus on platform work in care as a result. So what's interesting are some of the lessons that can be taken from other sectors that have seen platforms grow and the kind of strategies that unions have embraced in those sectors. So a 2023 report from the ETUI found that smaller platforms are actually more willing to engage in social dialogue, whilst larger players tend to have an attitude of avoidance when it comes to collective bargaining. Therefore, for unions, understanding very clearly what stage your country is at in terms of the emergence of platforms is important. So, for example, are there smaller platforms in existence right now that unions could target that could begin to negotiate or become involved in social dialogue or collective bargaining with? We see examples even of, large organizations in some countries that did sign up to collective bargaining agreements. So, for example, we saw examples in Denmark where the Hilfer domestic platform, for example, did sign a collective bargaining agreement, which had implications for worker status and terms and conditions in that regard. So there are some examples that can be looked at for trade unions in that way. Another thing trade unions can think about is the way in which they offer services to members that could be fruitful and more applicable to platform workers in particular. So, for example, in Belgium, we see the ACV and CSC. They established the United Freelancers Organization specifically to support platform workers. So members there pay the same membership fee as employees, but the services provided are very much tailored to those in a platform situation. So they look at providing assistance with interpretation of the platform platforms' terms and conditions. They look at providing support as well in terms of interpretation of contracts that are provided and legal support in some cases. Likewise, in Austria, the union VIDA focused on extending membership to freelancers and platform workers there through its VIDA Flex initiative. The next slide, please. In terms of pathways forward then for unions, unions can influence and have a role in changing platform operational models. So, for example, maintaining a media presence is very important in changing how platforms might approach their operational models. So, for example, there's some existing research from 2023 which showed that domestic platforms have actually varied their operational models in response to national regulations, and that the role of unions and the role of media attention has been very important in that. So, for example, we saw in the case of Helpling how their model was adopted quite differently in countries like Germany versus how it was adopted in countries like Ireland and the UK. And the effectiveness of those strategies has been pointed to as something which unions have a very particular element in playing a part of. The mapping of the presence of platforms at national and at regional level is important for trade unions, as the landscape can change quite quickly, particularly with unions which might receive funding as part of, or as platforms rather, which might receive funding as part of innovative startups, or as traditional agencies which are shifting their existing model from a traditional agency towards a more platform-based approach. So it's important for unions to be regularly mapping the sector in which they're working to understand how care provision is changing. Another key area of importance is building alliances with stakeholders. So, for example, having alliances with family carer groups, older persons advocacy groups, and migrant rights organisations, all of which are very much embedded in the care diamond or the care triad of care delivery. Care is very complex and how it's funded is complex, and therefore understanding the consequences of having better care and better jobs for all parties in that care triad is very important. So for unions, even for example, a sharing of things like sample contracts, a wider sharing of the understanding of financial assistance information, a sharing of tax obligations with those types of individuals and those types of organizations is important, so that they have an understanding of what are their duties in relation to being a family engaging with a care worker. What's also interesting is the role of some employer body interest representative groups. So for some employer bodies in relation to other sectors, we've seen where they have actually also engaged directly with trade unions because they too themselves feel that there is a threat maybe to their sector in terms of the emergence of platforms. So for some trade unions, it might be worth looking at whether or not there are relevant interest bodies in the employment sphere in their particular countries that are worth engaging with. There's also lessons that can be drawn from other areas of care and domestic work. So, for example, campaigns that have been successful in relation to childcare, not necessarily about platforms, but in relation to the provision of childcare and the professionalization of work in childcare, can provide lessons for trade unions in, for example, creating things like a register of care workers or establishing things like a joint labour committee in the care sector, specifically for home care or specifically for domestic work. And in terms of strengthening regulatory changes, the role of inspection and enforcement of labour rights and inspection services is a very important aspect which needs to be considered here. It's very complex and complicated for existing inspection services to enter private homes, and therefore again the invisibility of this workforce is something which trade unions have a role in focusing attention on. So in terms of identifying, for example, how workers are able to voice their concerns and the extent to which practices might need to be engaged in different countries. So for example, is there a code of practice for domestic workers? Is the Domestic Workers Convention adhered to in a specific context? So the next slide, please. So in terms of conclusions, what we find at the moment is that we have a sort of halfway house situation in home care between formality and informality. We have some care platforms which actually, are allowing clients to transfer into their system where there is an existing relationship between already a carer and a client, which existed on an entirely ad hoc, informal basis. And for families, this offers a real sense of maybe security for them that they're bringing this into some form of formal arrangement. For the workers too, that might offer some level of formality, but it doesn't address the issues in regards to employment status or social protection. So what we now have is a transition where we're looking at issues of not just undeclared work to regular work, but also differences between undeclared work, regular formal employment, self-employment as well. And that model may be masking issues in social protection. One of the biggest issues that we felt is a concern in this regard is how platforms might be contributing to a greater blurring of lines between care and domestic work. For unions, a greater differentiation is required and needs to be focused on in looking at the breadth of skills delivered in care. So in other allied health professions, skills are developed and tailored to needs. So supporting a broader range of job titles and grades should be considered so that care workers have clearer progression paths. Unions, for example, could campaign for an accrediting body or a register of care workers. So, for example, in Sweden, the trade union there, Kommunal, was successful in introducing a register for the practical nurse grade in the care sector, which is something which perhaps other unions could focus attention on and look at. As well, in terms of national, local and smaller providers who were once dominant in terms of the format of care, we're now seeing a growth in international providers. We're also seeing the emergence of some cooperative worker-based platforms, but we're not necessarily seeing a very significant difference between the types of terms and conditions that workers are having in each of these different models. So again, I think what we see is the issues here go back a lot to the valuing of care in society, no matter what model of employment that is delivered in. The primary problem seems to be how care is valued and how care is actually funded. And then finally, one of the concerns we identified in the report is the wider issue around migration and care. Many of the workers that are working on platforms are migrants. Many of the workers that are working in care are migrants. And we see within the European context an emergence of suppose a care drain, really, in terms of the proportion of the workforce which is now from either intra-EU migration or outside of the EU migration in the care sector. And the current model of care and the current funding of services disincentivize receiving countries from actually improving employment conditions to attract a local workforce. And this can further contribute to these broadening of a global north-south divide and a care drain in other countries. So I might hand over now to my colleague Ivana, who will speak specifically to the Italian case.
Thank you, Caroline. And if we can go to the next slide. Okay, so having seen the main results of the project, I would like to spend just a few words to present the Italian case. The report was based both on the Irish and Italian case, and but we try to get some general results. So with respect to these issues, Italy is a particularly interesting case because of its aging population and a care regime based on the so-called migrant in the family model. In Italy, we have a high number of platforms. As you can see, for long-term care, we have more than 20 platforms, which were born as a response to an unmet need of citizens, or at least that's what they say. As we have seen, it's not possible to speak of care platforms in the singular because of the differences between long-term care platforms and, for example, domestic cleaning or babysitter. But another reason why it is necessary to speak of care platforms in the plural depends on the heterogeneity of platform models and its consequences in terms of working condition and representation of workers' interests. Someone in the chat asked about our definition of care platforms. We adopted quite a broad definition of platforms. The idea is that we included all the websites allowing people to access and enroll to the platform and by filling in a profile. And with some exception, the only exception are about platforms allowing organization to enroll on the platform instead of single workers. Based on these platforms, we detected, we mapped, and we included in our analysis, we detected 3 main types of platforms. The first one is the on-demand platform, is the one more similar to the Uber model, where the platform displays the profile of careers and allow clients to contact them, but the negotiation of working conditions takes place outside the platform and between them without any intervention by the platform. We noticed that this usually leads to a strengthening of undeclared work, which is already, unfortunately, widespread in Italy. The second model is the model of the agencies, which operate like traditional brick-and-mortar agencies with some differences. The first one, of course, is that they do not have a physical office and everything happens online. And the second is that they use or at least declare to use some algorithms for manage the matching of demand and offer, and not to manage the work. In this case, usually the agencies, the online agencies, these platforms have a license. So they provide an intermediation that it's recognized legally. But they do not employ carers. What they do is that they verify that the family make the contract to the carers. The last case, it's a peculiar one. It's a platform that aggregates the offer of cooperatives. This is the case of platform enrolling organizations and not the workers directly. In this case, the carer is a member or an employee of the cooperative, and his or her working conditions are regulated by the cooperative, which offer its services through the platform. So this is to provide an example of the different kind of platforms we found in a country. And our research shows that these patterns, this heterogeneity between among platforms correspond to a stratification of workers, which depends on their strength on the labor market. I think that this opens up an important stream of research, but also allow trade unionists to, after analyzing better this difference, to provide also different kind of representation of collective interest based on the different profiles of platform workers and on the different kind of platforms. So thank you very much.
So I'm very happy to have joined this meeting because it also gave me the occasion to read your study, and among one of the big files that we manage in our unit. I see there was a hand up. I don't know if it's linked to hearing or not hearing me. Okay, I go further. It's precisely long-term care, because we have put 2 years ago, or almost 2 years ago, the European Care Strategy forward, and also the accompanying instrument addressed to member states, which is a Council recommendation on long-term care, which, as we have heard earlier, includes specific provisions with regards to improving working conditions, the attractiveness of the care sector, and addressing skills and labor shortages in the sector. It's true that we didn't have, and we don't have lots of evidence with regards to use of digital platforms for the care sector. So any study like yours just now published is very, very much welcomed. And what I take from your study is that not only that it echoes the systematic issues that we already knew that the care sector is facing with regards to high percentage of irregular work, working conditions that are difficult with regards to working time, health and safety at work issues, also access to social protection, low wages, low level of unionization, and just to name just some of the few challenges. So obviously with your study, I think it's also highlights that not only all these issues are affecting or will continue to affect people that are engaging through digital platform in the care sector, but also that there is potential to further extrapolate and exacerbate some of these challenges. I also liked very much in your study the fact that it has, let's say, good examples in terms of changes that could be enacted by trade unions through collective bargaining. And I think that this is really the mindset that we should look at the future. And maybe one issue that could come across more, and that's also subject for further research, maybe it's also the user's perspective, because I think the study highlights a lot what is the perspective of the workforce, of the workers, but obviously we hear time and time again from countries that have such platforms in place that also the users, because they are themselves vulnerable, they have troubles understanding the conditions, the contractual conditions, the services that they are getting. There could be abuses that maybe not so straightforward in terms of how they could report on them. And obviously, as always, how to ensure quality of the services in a private home remains an issue. I would also say, looking at the 3 options that you propose forward, that obviously ignoring and assuming that there will not be in the future digital platforms for this sector is not a very realistic solution. So I think very much the solution lies between options 2 and 3. Even a merging of the 2 options could be considered. And this is where the work that we do at European level with regards to supporting social dialogue and collective bargaining, it's very important. And maybe here I will make a link to the recently established sectoral social dialogue committee for social services that has already a quite important work agenda ahead with regards to all the challenges of the workforce, of the care workforce, but obviously maybe that's also one issue to further add for their joint work. Then maybe also I think where I see the link to the work that we do at the European level it's also with regards to the Council recommendation on access to social protection for workers and for self-employed. This is a non-legally binding instrument which invites member states to ensure access to social protection for all, no matter their employment status, with respect to 6 social protection branches, so those branches that are mostly contributory and linked to labor market participation, and which pays in particular special attention to people in non-standard forms of work and to self-employed. And in all our, let's say, monitoring implementation work, obviously we see most of the challenges linked to solo self-employed and dependent solo self-employed. So I think this kind of matches a bit, let's say, the challenges with regards to the platform work. So what we are also saying quite importantly is that being self-employed by itself is not a bad thing. What is important is that people have the right classification, being employed or self-employed, and also that even when they are self-employed, they can contribute to the social protection system and obviously also benefit of the social protection system. And this is where obviously the link to the platform work directive is quite important. And maybe I wanted to give you quick updates in terms of where we are with these instruments after the agreement between the co-legislators, the Council and the Parliament. Now the text is being reviewed by the lawyer linguist, and it is expected that it will be published in the official journal in autumn this year, after which member states will have 2 years for transposition. And also the Commission will set up a transposition working group to work with member states. Then some action, maybe I will use a couple of minutes to debrief you on what we are doing under the European Care Strategy to support implementation of the different dimensions linked to improving affordability, availability of care services, and also addressing the challenges linked to working conditions. So we have undertaken with the European network of European law, labor law experts, a review of the working conditions in the sector, and the results of this will be available in autumn. What this review shows to us that it's very difficult to map what is the care workforce, and this also made me reflect on one of your recommendations to be able to map the workers engaged through digital platforms in the sector. And it also showed that when it comes at least to the EU acquis, for the categories that are nurses and personal assistants, there is rather a good alignment to the provision of the EU acquis. With regards to domestic workers, and then by default also with live-in carers, while there are, I wouldn't say necessarily problems, but there are different rules that apply, rules that are, and this lex specialis is allowed under the EU labor law with regards to domestic workers. So obviously it's an issue where we will need to look more in the future, and we have launched a request for study on social protection for domestic workers. Then under the long-term care recommendation, member states appointed what we call national coordinators for long-term care, and they are due to submit to the Commission by June their implementation measures with regards to all dimensions of the Council recommendation. We are in the process of receiving these plans that we will also publish in the second half of the year. on our website, and we see actually that in some of the plans that we are receiving, quite a strong focus on workforce. So either with regards to attracting more people to the sector, to facilitating the training, but also financial incentives for undertaking such training, and better recognition and valuing of care work. The sectoral social dialogue, I mentioned it, and actually next week they will have their second meeting, and I'm very happy to hear next week of further progress. And with regards to skills, also there are lots of activities that are taking place under the Pact for Skill. This is bottom-up initiative. I think EPSU is also involved, and recently there is a big Erasmus project that can support part of the implementation of part of the commitments that stakeholders undertook under the Pact for Skills. And when it comes to access to social protection, we continue improving our monitoring framework, and both on long-term care and access to social protection, we engage in member states with mutual learning, where we involve social partners, civil society organizations, precisely to have this kind of interaction with all actors that need to be involved into finding sustainable solutions for the sector. So maybe I stop here, and just to say that, congratulations for your study, and very much supporting its conclusions, that we need also more in-depth analysis and further work into this phenomena of the digital platforms in the care sector. Thank you.
Hello, everybody. I would like to start by echoing the last speaker and giving huge congratulations to EPSU and FES for commissioning this report, which could not be more topical. It couldn't be more timely. I think you've put your finger on an issue that kind of sits at the nexus of a whole lot of different policy challenges that are facing governments right across Europe. The issue of care, it relates centrally to difficult questions about the relationship between the public and the private, between the national and the local, between medical services, health services, and social care services. It sits right at the heart of issues relating to gender equality, because women not only are the main recipients of care, they're also the main providers of unpaid care and the large majority of the care workforce. And these three roles sit in considerable tension with each other. And in the sort of context of the demographic crisis we're in right now, you could say there's a kind of crisis of social reproduction going on in Europe right now. And into kind of this great mess, along comes digitalization, raising a whole lot of new challenges and problems. And I think the authors of this report have done a fantastic job bringing together a lot of very disparate information from different sources and identifying the key challenges for the future. But I'm hoping that this is just the beginning, because an awful lot more work needs to be done in this area. And I'm hoping that this could be a starting point for future programs of work by all the participants. I mean, you've drawn attention to so many issues that I'm going to try and summarize them. The extremely fuzzy boundaries between different kinds of care, institutional care, home care, childcare, elder care, and domestic labor, which isn't really care. The enormous diversity of national models, which because we've seen in Europe over the last 20 or 30 years a kind of convergence in relation to employment policy, because it's been highlighted. But because of subsidiarity, there hasn't been such a convergence in terms of social policy. And so what we see is lots of very, very different national models, different models of payment, different kinds of regulation, different relationships between the public and the private, and so on, which is a huge challenge if we're trying to sort of pull out policies that apply Europe-wide. There are also a whole lot of issues related to the extreme vulnerability of the workforce in care work, because of their migrant status, because it's emotional labor, because of the invisibility of the way they're working in these isolated situations. And as has already been said, this isn't just a vulnerable workforce, they're also working with vulnerable clients. And in the UK, at least, there have been a lot of very high profile cases of abuse of social care clients, mainly in the institutional settings, but who knows what is going on in the non-institutional settings, because the workforce is under such pressure. So I've been asked to sort of talk about what the implications are for trade unions. And I think trade unions in this sector have, over the past few years, been facing enormous challenges, particularly challenges of privatization, challenges of austerity and public spending cuts at a time when demand has been going up. So they've inevitably had to be very reactive. They've been reacting to different sort of assaults, if you like, coming at them from different directions. But what is needed now, it seems to me, is for trade unions to become much more proactive, to actually move out there into the public space, put issues onto the public. I know this is easier said than done, but to put issues onto the public agenda and to start a public debate that brings these issues out into the open air, so to speak. Issues relating to training and certification of workers, issues relating the applicability of minimum wages, issues relating to working conditions and employment status, the clarification of rights, issues also of the regulation of some of the labour market intermediaries. I mean, people traffickers are an extreme example of this, but there are a whole range of different labour market intermediaries operating in this sector to not just the detriment of workers, but to the detriment of their clients very often. So it seems to me that there is a need, as I said, for raising a public debate and for trade unions to enter into partnerships with other stakeholders, especially I think at the local level, because a lot of care is managed and regulated, although this varies from country to country, but at the local level. And to possibly propose, this is something in my last book I wrote about, and the idea is sort of a little bit sunk like a stone, but I still think that it's very important that we don't just accept that, okay, the public sector is shrinking, digital platforms are growing, you know, let's all take as inevitable the growth of this digital management by private companies of public care. Why can't we take the best of both worlds? It's clear that the digital technologies, the platform technologies, are actually wonderful from the point of view of managing the matching of patients with of clients with workers, of providing workers with the kind of flexibility which workers always say they want, and with just intelligently managing supply and demand and keeping track of what's going on. But there's no reason why these technologies should be in the hands of private companies. Why can't these technologies be in the hands of public actors? And it seems to me that what we really need is to set up some experiments of public care platforms, which bring together different stakeholders at a local level, which would make it much easier for trade unions to be actively involved in the negotiation of the employment conditions of the workers and in the setting of standards, and also in enabling the kind of enforcement regimes which are so lacking at the moment. We don't just need quality standards, we don't just need information, but we also really need, I would argue, inspection regimes and enforcement regimes at a local level. I think I've probably gone over my 10 minutes, so I'll stop now. But anyway, I commend that to you as an idea. Thank you for your time.
So thank you, colleagues. I hope that you could hear me also in the translation mode because it's English. I would like to thank participants for participating in our presentations of our reports, in particular Dana from the European Commission for her really kind words about our initiative to prepare this report and to conduct research. And of course, with social employers and employers organization from local government, we'll be seeing very soon in order to discuss one of the topics of our work program in sector social dialogue in social services, actually related to digitalization. I would like to thank Ivana and Caroline and Tish, who is not with us, for drafting this report. And also to our affiliates who are in contact with the researchers, mainly colleagues from CGL from Italy, but also another trade unions and also colleagues from Ireland. And I think that we are really glad that we started this important discussion, started against with the initiative of FES and us joining these initiatives. And I think it's a really starting point to provide more reports in the future and also to try to developed policies that will be protecting workers, but also care recipients from artificial intelligence and from the platform work. I think this report very much is being embedded in the discussion on the European Pillar of Social Rights, as Dana mentions about the 18th principle of the European Pillar of Social Rights. We also have discussions being launched on the global level, that is by the by the International Labour Organizations. As you know, some of you, there was a conference, annual conference last week, that the conference which takes place always in June. So the conference finished 2 weeks ago, and the conference was actually discussing care in relation to the care economy. There is a very good resolutions made by the conference, by ILO conference, which mentions, of course, the issues of a care economy. So I really hope that this report that we publish will also influence the future work of ILO in relation to care economy. We also, and this Oliver and Ivana, we've been to Bucharest at EPSU Congress when we also presented this report, and we have a colleague from the Eurofound, mainly Hans Dubois, who was also mentioning that Eurofound is working on the care work and digital platform. So again, this report will be probably mentioned there, and again will be used this topic to further research. And finally, going to another European institutions, we also know that the European Agency on Occupational Health and Safety in Bilbao, that is EU OSHA, is now having a project on safe and healthy work in the digital age. And again, platform work is very much related to digital age, platform work and care work. So colleagues, without further ado, I don't want to make another speech about what we will be doing. It's an excellent report. I think we should be really grateful for ourselves to having this initiative, also in particular to Friedrich Ebert Stiftung. We'll be working on that more. There will be another opportunities for you to probably meet with us or to read this report. The report will be sent to you as well as with the presentations we made. We actually also probably not publish, but put the video from this conference on the YouTube channel. We'll be in touch with you. And I think we'll be discussing this report in the further publication and further conferences in terms of ongoing work. But the one thing which is important here, it's about the care platform work, which is highly feminized, and it's become precarious work. And I think we really need to underline this, that care is not the commodity, no? So when we really have this approach that care is not commodity, then you cannot make any profit from care, rather that you need to protect care and care workers. I think that will be the biggest lessons or the biggest thing that we learn from that. So I would like to again thanks for all of you, in particular interpreters, for the patience in terms of allocating the channels. And I'm looking forward to hearing you at some other FES and EPSU events in relations to this subject. So colleagues, enjoy your afternoon in Brussels, and thank you, Ursula, thank you, Ivana, Caroline, Pete, Dana, Oliver, and I think that's all what I said. Demis, anyone? No, and our interpreters. So thank you very much, and we'll be in touch with you, and thank you for participating in our launch of the report. Thank you.